drug business was pretty good for them. But now, because there's a crackdown on drugs, they've simply gone into a much simpler white-collar crime. Rob Medicaid, rob insurance companies and the others. You know, insurance companies used to have what they call claim adjusters.
Mm-hmm.
You know, they're the claims people who investigate. But now they're actually having police investigate. They're hiring detectives, not claim adjusters, to go after some of this fraud. So that's pretty big. So, folks, what the article is trying to say, there are a number of ways to become efficient now, only is that we need to take care and be the drivers. And we are not yet drivers, but we can be if we combine our forces.
Completely agree. Speaking of medical issues, H1N1 is still capturing our attention these days. And in fact, over the last 6 months, there have been 540 pediatric deaths as a result of the H1N1 virus. And we also know that area hospitals have had a significant upsurge in the number of people that have been treated through their emergency rooms, their clinics, and even hospitalized on their wards. And I think it's important for folks to recognize that the vaccine is one that we certainly should be considering. I know in our previous show we talked a little bit about why people are wary of the vaccination, and I just wanted, as a pediatrician, to bring up some of the importance of getting vaccinated. I'm, as you know, 5 months pregnant, and I definitely received the vaccine when it first came out because I'm considered a high-risk group. And other high-risk groups include people that are caring for infants under 6 months of age and children that are under 2 years of age. And in fact, I got my 15-month-old Nikhil vaccinated as well. And what we are seeing, again, is that there are certain target populations that are much more vulnerable, at higher risk for death or other complications. Now, the other group that should get vaccinated are whether it's children or adults, people that have chronic conditions like asthma or diabetes or other conditions that would cause them to be immunosuppressed. So I think, again, it's an important message for all of us to be aware of, is that there is a vaccination campaign that's going on. It is difficult to receive the vaccine, and it can certainly be a source of frustration, but certainly you have the opportunity, and particularly if you're in a high-risk group, consider getting it. I think that the benefits can really outweigh the risks in this particular vaccine.
One of the news reports happened to say that it's not as bad as we thought it was going to be. Is that true?
What we see is that there has been a significant upsurge in the amount of H1N1 disease right now, and in fact they think it may be worse than they thought it was. So I think time will still tell whether or not this will be as bad as all of the dire predictions, but I think that it certainly is in keeping right now with the number of people that we think are going to be sick. So I, again, encourage folks to find out from their local health departments or from their local primary care departments as to where they may be able to receive the vaccination. But it's really just a variation on the seasonal flu vaccine, and I really think, again, the benefits do outweigh the risks.
And it's not too late.
It's not too late, no.
There you go.
For decades, the cosmetic industry has been making millions of dollars by selling skin lightening products to women. Well, now the tables have turned, and the cosmetic industry is now making money off of selling skin lightening products to men. It seems now that skin lightening products is one of the rapidly increasing markets in India, and in fact, sales of things like bleaching creams have increased 150% in the last year among men in India. And there's a number of TV advertisements that send the same message, which is light skin makes you attracted to women and successful at work. And if you're dark-skinned, by implication, you are not successful and you will not be able to woo women. This is reinforced time and time again by both TV and newspaper ads. Now, the cosmetic manufacturers say that their products work over several days or weeks, and what they try to do is to lighten the skin and contain some sunscreen and a moisturizer and maybe even something that changes melatonin, which causes the skin pigmentation that determines one's color. And according to various folks, what they say is it's a classic example of you are trying to get what you don't have. And so certainly in this country where people are that are more white-skinned want to become more brown, so they look for a tan, whereas in India, people that are a little bit more darker-skinned want to look more white. Now, others say that this is an issue that's really kind of stems from the class system and social hierarchy and things that have been in India in existence for many years, and that historically, if people worked in the fields, they were considered perhaps a little bit lower class and were darker skinned, and people that had the money didn't have to work outdoors, had less exposure to sunlight, and were fairer.
You know, when white wants to be brown, they have to go in the sun, and it can affect the skin, and you can have lesions or cancer and the others. So when you go from black to white, you as a physician tell me what can happen to them if it doesn't go right.
Well, certainly you can see examples of people like Michael Jackson, who became very white over a period of time. And so I think that there are examples where bleaching agents can be harmful. I think probably the bigger issue is psychological harm, and that's where I think there's been a lot of outcry, that this is just really reinforcing caste stereotypes, and this is really damaging, and that really trying to get people to look lighter and to feel better and to say that they're going to be more successful and get more women because they're lighter skin is really kind of going backwards in some ways. And really everyone should be thinking about their inner beauty and what they're born with, and not so much in terms of their color.
Well, I remember the boys that were dark, the mothers used to call them, "That's my Krishna boy," because Krishna was dark. So whenever you have a dark son, they would say, "Oh, that's my Krishna boy." You know, I guess I was called Krishna boy one time. Moving on, Windows 7 promotion that occurred in Japan is very interesting. They went to Burger King and they said, well, we want to make sure that you carry out a promotion of 7 patties. Hamburger with 7 patties.
That's a lot of patties.
Japan, it was popular actually. You know, the first 30 sandwiches, they sold it for $8.60. And then the rest of them, they sold it for $16. Burger King got such a huge publicity because the YouTube carried how Japanese were trying to bite it on the 7 patties. So Microsoft got a good plug out of it, and Burger King got a great mileage out of it, so they're going to increase their units in Japan. But I thought it was interesting. Microsoft Windows 7 decided that that was a good promotion.
Interesting collaboration.
Yeah.
Well, folks, Sesame Street is turning 40. Yes, it's the show that brought you Big Bird, Ernie and Bert, and Cookie Monster. It taught generations of kids how to count, and it's now in 125 different countries. It was started initially by the Children's TV Workshop in 1969 for families, and in fact was trying to bring education to families that couldn't afford it, and particularly preschool education, and also to present racially diverse programming. And we know that Sesame Street has certainly been one to really tackle hot topic issues. For example, in 1990s, it brought Sesame Street to Israeli and Palestinian youth in both Arabic and Hebrew, trying to help on cultural sensitivity issues. And we also know that it brought the first HIV-positive Muppet, whose name was Kamai, to South Africa, again trying to tackle the issue of HIV and AIDS, which we know is a pretty significant one, particularly in Africa. Now, what's interesting is how much things have changed in the last 40 years. So in this most recent anniversary episode, Michelle Obama was featured, and she was talking about what else but